On the line with us, we have Dr. Kevin Bernstein, family medicine resident and intern at the Naval Hospital in Pensacola, Florida. Follow him on Twitter at BirdieMD31, and also check out the blog at futureoffamilymedicine.blogspot.com. You know, you are resident chair of the hugest, the biggest resident and medical student meeting in the country, I believe. That's going to take place this summer. It is the National Conference of Family Medicine Residents and Medical Students, taking place July 26th through 28th, 2012 in Kansas City. So let me just start out this conversation, Kevin, by talking about. I'd like to talk about that meeting first, as far as that's kind of where we kind of met, like on the radio, and tell me why why is that meeting important to you? Why should it be important to residents and medical students? Why is it important to family medicine in general?
Well, for me personally, that's where I kind of got my start as far as in family medicine, not only just with the leadership opportunities that I've had, but just with the energy and the community of family medicine as a whole. You only get a little taste of it being in medical school, being in your clinical rotations, your family medicine interest group, which you only meet with, several times throughout the year. This is a time where over 2-3 days you get, in your face family medicine, not just the specialty and its scope, but the people that are involved in it. And I think that's the big thing. It's that you can come to understand the scope of pretty much anything. A little bit more difficult to figure out the scope of family medicine depending on what medical school you're going to in the region of the country you are to realize the broad scope of family medicine. But once you get there, you learn the scope if you haven't learned it before, but you also get to meet all the people within the community. I think that was probably the biggest thing that I learned coming to the national conference was the people within the specialty are just fabulous. It's the camaraderie, the passion just for patient care, for the specialty, just for medicine in general. It's an energy that you can't feel anywhere else. It is, like you said, the largest resident and student conference. It is. Out of any specialty, out of medicine as a whole, it is the largest resident and student conference in the country. So that's another thing. You're never around as many residents and students at once. You're never around as many residency programs at once. So it really is a celebration of the specialty, and I feel a celebration of medicine in general, because when you think about medicine, everything that family physicians do is medicine. When I grew up, envisioning what type of doctor I wanted to be, just looking at my life in general, I like to do pretty much everything. That's how I approached medicine. I wanted to do a little bit of everything. And being able to be a part of that, being able to be around people that practice medicine. That was my definition of medicine, is family medicine. That's where it really came together for me, especially at my first conference, where I knew a little bit about family medicine, but I didn't know that much. And it really brought that to light to me. So definitely the experience, I would say, to any medical student out there, whether they're first, second, third, even if they're about to be a fourth year going into, their fourth year, applying, figuring out what specialty they want to go into. Even if they don't end up in family medicine, just to learn about the specialty, being able to learn about the community. It's just, it's like I said, the largest, you can't compare it. You have to go to it.